Hey everybody, Katrina Sanders here with Dr. Barry Bartusiak. We are here live at Chicago Midwinter. How are you, Dr. Barry?
If I was any better, I'd be twins.
Oh wow. I love it.
Yeah.
Yes, all right. And we are here at the Synapse Dental Pain Eraser booth. And we're here sharing with everybody about some of the newest, latest, and greatest innovative technology to hit dentistry today.
There is no doubt about it. What a game changer this has been for my practice. How about for you?
Oh, same. Absolutely.
Yeah.
So what we're talking about today is dental pain erasing. Now, this is a new concept in dentistry because we're used to numbing the patient, right?
It is a complete mindset difference. You're absolutely spot on with that. And I think doctors need and hygienists need to embrace that we can provide pain relief painlessly.
Oh my gosh, how futuristic is that?
It's amazing, right?
Truly,
Yeah,
before
is,
this,
right.
what was our option? I'm going to take a 27 gauge, a 30 gauge, long, short needle. I'm
Right.
going to penetrate your tissue
Right.
with a highly acidic anesthetic. I'm going to numb you up for a long period of
And
time.
you're
The
gonna
infection in your mouth is going to
Yeah.
come and here we go, right? It's the age-old concept of the things that we do in dentistry, and it's honestly why I think patients say to us,
I hate you.
no offense though, no offense, but I hate
I
you.
hate you.
And
Not that's affected me.
Yeah, of course. Yeah.
Sorry. I'm sorry.
And yet here we are on
Yes.
the other side of that as two providers who have found a way to change and innovate what it is that we're doing for our patients
it's a
through
gift.
the erasing of our patients' pain.
Yes, it's been a gift. It really has been to our profession, I think. Yeah.
Absolutely.
Yeah.
So one of the first questions that we do get asked quite a bit is, what does it actually do? What is the technology? So let's just take a short minute here to talk about what it is that this particular technology does. This dental pain eraser literally erases the pain. And what I mean by that is there is a small, what we call subsensory release of an electrical pulse. Subsensory means the patient doesn't actually feel a vibration, right?
Not at all, no.
Patient's not going to feel it.
No.
They might feel a little bit of warmth in the area,
A little pressure.
just a little bit of pressure.
Right.
You apply the two little probes. Can we get a little zoom in, shall we?
let's do
All right,
this.
here we
Right.
go. You're going to apply the probes. This one has 4 probes on it, so let's go ahead and rotate it just a skosh so we can actually see those little probes there. You take and you apply the probes to the area where you wish to erase the pain. When this occurs, this subsensory impulse actually stops the pain receptors. Now that's an important critical component because when we anesthetize, when we inject our patients, we are targeting all of the nerve receptors. We're talking
exactly.
about motor, we're talking about
Right.
all sensation, right? It's why the patient can't feel this. It's why pediatric patients, when you anesthetize them, you say, be very careful. They could traumatize those
Absolutely,
areas, right?
right.
Because they can't feel it. This is different. We are now only targeting pain receptors.
Right. We're using a rifle approach rather than a shotgun approach.
Oh my gosh, I love that. How incredible. So with this technology, and by the way, this is not new technology. We've been using this technology for decades in treating trigeminal neuralgias
Yes.
as a way of helping to alleviate pain. Dentistry is a bit behind the times, of course, when it comes to taking and integrating some of these things, but fear no more.
Hey, we're here.
Because
Right.
here we are on the other side of the newest, latest, and greatest small device that allows us to mobily address our patient's pain perception. So with this device, we have 2 different types of devices that are available.
Yes.
One is a professional device, meaning
Okay.
that we would apply this alongside our patients in patient care. The second is a patient take-home device.
Right. Yes.
And how amazing is that for us to be able
Unreal.
to offer this as an
Unreal.
opportunity for patients
Right.
post-operatively?
To manage their own pain.
To literally empower them. When we
Absolutely.
talk about
Right.
patients managing pain at home, before the pain eraser, what did you tell patients to do when it came to managing
Tylenol
pain?
and Advil. Good luck.
Tylenol and Advil, and have a great time. Try and, create a cocktail of those two.
Exactly. Wash it down with a beer or two. and
Sure,
there you
of
go.
course.
Right.
There
Yeah.
you go. Absolutely. That's the way to take care of some pain. And in addition, one of the biggest concerns that we do have is dentistry's role in the opioid crisis.
Absolutely.
We know about
It's
60% of the scripts
Yes.
that are written for opioids are written by dentists.
Exactly.
And
right.
so it becomes really important from a stewardship standpoint to
Yes.
ensure that we are
No
doing
doubt.
things to empower our patients.
Absolutely. In my neck of the woods, Western Pennsylvania, we've been hit, decimated just decimated our neck of the woods with that. So that's
Wow.
that's a powerful tool to, as you stated, to overcome that.
Absolutely.
Of our practices. Yeah.
Absolutely.
Yeah.
So when we're talking about take-home care, we're talking about patients that might have post-operative pain, post-operative tenderness, etc.
Right, whether it be from oral surgery, whether it be from orthodontics, whether it be from a filling. Everybody's a little bit different. As you know, some patients you have to get numb in your perio practice
Sure.
for a routine cleaning and exam, and some people, okay, just do it. So it's really provided many pathways.
That's
as
right.
you stated, right.
I love it. So let's talk about some of those
Sure.
pathways, shall
Okay.
we?
Yes.
So you are a doctor in a general practice.
That's correct. Right.
How do you use the dental pain eraser in your practice?
The dental pain eraser for me has been a jack of all trades. It started out, I got this at the Chicago meeting last year, and I'm like, okay, and it almost sounds too good to be true.
It really does.
Honest to goodness.
Don't people say, like, does it really work, though?
Right, exactly.
Yeah.
Right. Does
Yeah.
it work?
Does it work?
You mean just click this button, click that button, blue light comes on, and I can use this for 330 minutes, and then I just use the next one.
Right.
Really? I just rub it on their gums and their tooth that I want to affect, and that's all I have to do. Yeah. So I was a bit skeptical, then I'm like, okay, well, just jump in because it's such a low hurdle of entry. No training. I just trained you, by the way.
Yeah. Literally, that was the training.
That was the training. All right.
Are we handing out CE credits for that?
Well, one CE credit. There you go. And that's a great aspect for us because
Yes.
everything else that you buy, well, doctor, it's this, hygienist, it's this, and there's 7 hours out of your day.
Yes.
And then the other aspect is, you get it in the box tomorrow, you're using it tomorrow morning.
Right.
So it's just been an absolute gift to our profession.
Yes.
So using it, what do we do? Post-crown cementation. That's
Patient's
been
uncomfortable,
Yeah.
you take the crown off, the temp off, and
Oh,
it's,
man.
and
Exactly. It's tough. And that's a challenging part because the patient's going, look, dude, I paid you a bunch of money and now it hurts. It didn't hurt before you did this.
Right.
Great. Rub it along their gum tissue and along the tooth, long axis-wise, and boom, magically, it's gone. And I have to tell you, this is what happens almost every time. So a patient will come in and they'll say, I don't think I need a root canal. I just have maybe let's call it a tooth bruise, doc. Okay. And I'll say, well, what's your pain level? 1 being a mosquito bite, 10 being a train wreck. Where are you at on that? And they'll say, maybe it's about a 5. I say, okay, well, I'm going to use something and not get you numb and not write you a prescription. Is that okay to get you out of pain?
What patient is going to argue with that? What patient is going to be like, no?
But they look at you like,
yeah.
What?
Where are you from? The
Right.
future?
Yeah, exactly, right? Yeah, Mars, hello. So then I do the deal,
Okay.
and a minute later, and every time, in the whole year, every time, I'll say, oh, Mrs. Jones, so tell me, how does that feel now? What's your pain level, 1 to 10? 0. And they look at you like, what did you do? It's almost magical. So I call it being a hero because I've had patients over the course of time in the last year say, you're my hero.
Wow.
Yeah.
How
Who doesn't
amazing
want to
is
be
that?
called a hero?
I mean, who
right?
doesn't, right?
I mean, seriously.
You have literally transformed the no offense, but I hate you into
Yeah.
you are my hero.
You're my hero. Right.
So what you're saying is if we can change our patient's relationship with pain in the dental practice,
Boom.
that we can transform the
Talk
way
to me, girl.
patients experience
You got it.
dentistry.
That's right.
I love this. This is absolutely fantastic. So
Right.
you use this for crown cementation.
Yep.
Can you use it for restorative? Like if I need a filling done, could you
Yes.
use it for that?
So again, everybody's a little bit different,
Okay.
pain management wise. So if it's somebody that you've worked on before and you didn't have to give it too much anesthetic, say, hey, Mrs. Jones, we just have a little filling, 11 buckle. Let's try it on this. Okay. Mrs. Jones, how's that going? If there's any problems, raise your left hand and I'll stop. She doesn't raise her left hand 9
Wow.
times out of 10.
How incredible.
So, and to go back on something that you stated, and so powerful, case acceptance is going to go up. Why is case acceptance? Why is your bottom line going to go up? Your bottom line is going to go up because what you just stated, and that's so powerful. You're so bright. And the reason it is
Dr. Barry.
You'll give me an hour to stop, right?
Oh my goodness. Oh, start.
you're so bright and intuitive. But what it is this. If I have a crown and I'm in pain and the doctor can't relieve my discomfort, would I get the second crown that I need?
No. And will you
Right.
trust that doctor?
Boom.
That's it.
Right.
Yes.
And that's all we really have in those relationships.
Yes.
When you boil everything down, The only thing that we really have is trust.